what is the NCLEX built off of? Have you seen their practice statements? So the NCSBN goes out all the time collecting data on what we actually do in our day-to-day practice. They make what we call practice statements, and those are completely accessible to you. So you can go and look at those at any time. But based on those practice statements, based on what they've gathered from nurses out doing the work every day, whether it's at home, in the hospital, wherever, they gather information about what it is that we do every day and what it is that we don't do, and how complex or not complex that situation might be. So they come up with practice statements. Based off of those, they create questions, okay? So that's the first thing to understand. Nobody's sitting in an ivory tower trying to figure this out. They're actually sending out surveys to nurses, just like us, to ask us what we're doing every day. Then they make these questions, and they fit into a set 8 categories. And when you look at the blueprint, each one of the categories is broken down according to which one of those practice statements should go into it. So for example, if one of the practice statements has to do with advanced directives, then you're going to see a statement about advanced directives under your management of care category. Okay? So this is absolutely a transparent process. Everything that you're going to be tested on is in there, and with some depth. Now obviously they can't include every possible thing that they could ever test, but there's a lot of depth in that document for you to grab a hold of and work from. Then the other thing is they work off of the nursing process. So occasionally in your exams within your curriculum, you'll see questions where basically the question asks you to diagnose what's wrong with someone, okay? Now that's easy for educators to write because that's an easy way for us to make sure that you understand the symptoms that are associated with a specific condition. But on the NCLEX and in real life, it's not your job to diagnose anybody, right? So these questions are geared entirely around the nursing process. What the nurse needs to recognize, what the nurse needs to do, what the nurse needs to assess. So really, the practice statements, those categories, and the nursing process are entirely what the test is built off of. Exactly what we've been prepping you for a couple of years, okay? So there's nothing shady, there's nothing new. They're not going to ask you things that are at an advanced level. They're not trying to find answers that somebody who's been in practice for 5 years would know. They want to know exactly what you know and that you're not going to hurt somebody when you get on the floor.